So today, we're going to walk through a classic UKMLA station from start to finish, Parkinson's disease.
Welcome to this clinical walkthrough on a Parkinson's disease case for UKMLA, brought to you by Medi8, your 24/7 practice partner.
All right, here's our game plan. We're going to follow the exact flow of a real clinical encounter, starting with how you walk in and introduce yourself, all the way through to explaining the diagnosis and setting up a solid management plan.
Okay, let's get right into it. The first 30 seconds of this station are absolutely crucial. How you open this consultation really sets the tone for everything that follows.
Now, this opening line is your secret weapon. Why? Because it does three things all at once. You're building rapport, you're confirming the patient's identity, and you're getting consent for the whole consultation. Saying it this way gets the encounter started on exactly the right foot.
Right, let's move on to the history taking. Your main goal here is to be super structured and efficient, so you can gather all the clues you need to solve the puzzle.
To give your questions some structure, I want you to use the ODI-PARA framework. This little mnemonic is perfect for guiding you through exploring that presenting complaint, in this case, the difficulty walking. It covers everything from onset to any other associated symptoms. If you follow this, you won't miss any key details.
Next up, and you absolutely have to do this, is screen for red flags. Asking these specific questions helps you rule out other serious stuff, like a stroke, MS, or even drug-induced Parkinsonism. This shows the examiner you're thinking broadly and considering other important diagnoses.
Now, here's where you really start to narrow things down. Ask specifically about the tremor. Is it happening at rest? That's the classic sign for Parkinson's. Then you have to ask about how it's affecting their life, things like falls or getting dressed, and always remember to ask about changes in their handwriting and if anyone in the family has had similar symptoms. These are the details that build your case.
And please, don't forget to ICE the patient. Ideas, concerns, and expectations. This is a massive part of patient-centered care. In this scenario, the patient is worried about being able to play the piano. If you can pick up on that and weave it into your management plan, you're going to score big. It shows you're treating the person, not just the condition. Okay, quick pause. If you want to get really good at this and make these skills feel like second nature, you can practice this exact case right now and get objective feedback on mymediate.com.
All right, now that you've got a really solid history, it's time to move on to the focused neurological examination.
How you transition to the exam is so important. Using a phrase like this works perfectly. You're summarizing what you've done, you're explaining what's next, you're reassuring the patient about their privacy, and, most importantly, you're getting that informed consent before you even think about touching them.
So your examination literally starts the moment you ask the patient to stand up. Be on the lookout for those classic signs. On inspection, you're looking for that masked face, where they have less facial expression, a stooped posture, and that pill-rolling tremor. Then, when they walk, watch for any hesitation when they start, a shuffling gait, less arm swing on one side, and that classic difficulty turning.
So how do you actually test for bradykinesia, which is just a fancy word for slowness of movement? It's easy. Use these three simple tests: finger tapping, foot tapping, and opening and closing their hand. What you're looking for is not just slowness, but also any hesitation, and if the movements get smaller and smaller as they go on.
To wrap up the exam, you need to check for a few other key signs. Feel for rigidity at their elbow and wrist. You're looking for that classic cogwheel feeling. Ask them to write something for you to check for micrographia, which is when their handwriting gets really small. Listen to their speech for that soft, monotone quality. And here's a top tip for the exam. Always say out loud what else you would do. Like, I would also perform a full cranial nerve examination. It shows you have a complete approach.
So you've gathered all your evidence from the history and the examination. Now comes the big moment, putting it all together and explaining your findings clearly to the patient. This is exactly how you should deliver the diagnosis. You link it directly back to your findings. You're not just stating a diagnosis, you're showing your clinical reasoning. By saying from the history and from the examination, you're walking the examiner through your thought process step by step.
When you're explaining Parkinson's to a patient, you have to keep it simple and clear. Ditch the jargon. Talk about brain cells, a chemical called dopamine, and how when you don't have enough of it, it affects your movement. This explanation is so much easier for a patient to understand and helps them feel more in control.
Okay, we're at the final section, your management plan. This is where you really prove that you're a safe, competent, and supportive doctor.
Your plan has to start with three key actions. First, an immediate referral to a neurologist. Second, you have to mention that the neurologist might do some investigations, like an MRI, to rule out other causes. And third, you need to introduce the idea of treatment, mentioning there are medications like levodopa that can help with their symptoms.
Remember, good management is a team effort. You have to mention the multidisciplinary team. Physio, OT, and speech therapy are key. Give them practical lifestyle advice on things like exercise and diet. And this is a big one. You must give clear safety advice about driving. That's a critical point you cannot afford to miss.
To finish strong, you need a clear safety net. Tell the patient exactly when they should seek urgent help. Arrange a definite follow-up appointment. And finally, offer them resources like a leaflet from Parkinson's UK. This shows you're thinking about their long-term support, long after they've left your room.
And there you have it. You now have the complete framework to confidently manage a Parkinson's case. So, are you ready to put it into practice? You can try this exact scenario right now on mymediate.com.